Muy buenos días.
Good morning. Today I'm going to present the current animal health situation worldwide, an analysis of events and trends. But first of all, I would like to thank the WAHIAD team, and in particular Lina Wan and Lina Mood and Paula Tipsani, who've supported us in providing the information and in risk analysis. The information that I'm going to present includes the information sent by the member countries and territories as of 17th May 2019. This year, we took a different approach aimed at ensuring global compliance with reporting obligations and the general quality of the reports submitted. We're also going to present two different groups of OIE-listed diseases that are of particular interest. They're going to be divided into two groups depending on their transmission pathways. That is to say, 3 vector-borne diseases, the Rift Valley fever, the West Nile virus, and blue tongue. And 3 diseases that are spread through animal movements and movements of animal products: avian influenza, the Coicarpa herpes virus, and the infection by the Batrachococcytrium salmondovirans. We're also going to present an update on the OIE WAHIS project. First, we present the compliance with the requisites established in Chapter 1.1 of both codes in terms of presenting reports, as well as the notifications by our countries and territories. The information is being used to evaluate the mechanisms in which the modernized OIE-WAHIS system can provide and improve the process of notification. It's important to recall that although the OIE's information department is responsible for verifying the information, it rests with the member countries and territories to send timely and quality information. When it comes to the early warning system, Article 1.1.3 and 1.1.4 establishes an obligation, that is the presentation of immediate notifications within 24 hours of an event's confirmation, and follow-up reports on a weekly basis. As you can see, the trend when it comes to notifications has been upwards. Was upward from 2005 until 2018. The medium notifications were 91 in 2005 and then 332 in 2018. Moreover, the follow-up reports have considerably increased from 164 in 2005 to 1,746 in 2017, with a brief drop to 1,655 in 2018. That represents 10 times the number of immediate notifications presented by the member states over those 13 years. I would like to draw your attention to the fact that more than 57% of the immediate notifications regarded 4 diseases, mainly 23 high pathogenic avian influenza, 17% for African swine fever, 10% for FMD, and 7% blue tongue. FMD and blue tongue are the diseases whose percentage has been the most stable year after year. If we look at the information provided since 2005 per OIE region, the regions that have presented the greatest number of early warning reports were Europe, 55% of the total, then Asia, the Far East, and Oceania, 26%, the Americas, 15%, Africa, 14%, and the Middle East, 4%. However, the contribution of the different regions to the total number of reports has varied slightly over the years, mainly due to the zoosanitary situation in the different regions. We should also consider the fact that these percentages are affected by the number of countries that make up each region, as well as the size of the region. As you can see, Articles 1.1 and 1.4 of the Terrestrial Animal Health Code and the Aquatic Animal Health Code stipulate that members must submit immediate notifications within 24 hours of event confirmation and follow-up reports on a weekly basis subsequent to an immediate notification. Taking that information into account, we evaluated all the immediate notifications for the OA-listed diseases, and we made an analysis for the 3 most highly reported diseases from 2015 to 2018. That evaluation took account of the time elapsed from the appearance of a disease to the confirmation, from confirmation until the report. We calculated the averages and the median figures, but medians figures were more interesting because they're not affected by the breadth of the spread. The median time for sending from the first outbreak to confirmation for all diseases was around 5 days. That is 5 days from the outbreak until confirmation. But at times it has gone up to 150. The maximum was 352 days. From confirmation to sending of the report, the median was 3 days and the maximum was 280 days. Globally, the median time from the initiation of the event until the reception of the immediate notification was 11 days. Most of the notifications were sent rather quickly, where some took quite a long time, even more than a year. The average value, if you look at this slide, in the case of FMD, the averages were a bit higher than for ASF and HPAI. It's important to recall that despite this broad range of notifications, most of the notifications were provided within the 24 hours, which is the stipulated time frame. Pursuant to Article 1.1.3, there's also an obligation to present semestrial information on the absence or presence and the evolution of listed diseases. These are essential in order to monitor the evolution of the diseases over time and to share information on the control measures applied. In these reports, compliance by member countries and territories for presenting the semestrial reports was rather high for all countries. This should be considered an important accomplishment. As of 2012, it's expected for the members to submit a specific report for terrestrial animals and another separate report for the aquatic animals. This is where we see a difference. From 2005 to 2011, when there was only one report, between 95 and 96% of the member countries and territories sent the reports. However, this percentage kept up from 2012 to 2017 for the aquatic animals. However, rather for the terrestrial animals. However, for the aquatic animals, compliance isn't as high. So, we looked at the content of the semestrial reports with respect to the level of detail provided for the diseases. And according to whether the terrestrial or aquatic animals, the percentages of the information presented with a more precise information, that is to say quantitative information provided per month and per administrative division, is higher in the terrestrial animals. 50%. However, when it comes to the aquatic animals, 52% of the reports did not have the specific diseases, and 18% provided no quantitative information. Moreover, in terms of the median reception time, it went down by 9 months for the first semester of 2006, or rather from 9 months to 4 months for the first semester 2018. Therefore, as of 2011, there's been an average of 3 to 4 months for submission. When it comes to the annual reports, they include contextual information on the capacities of national veterinary services in terms of personnel, diagnostic laboratories, vaccine production, information on the zoonosis situation in human beings, and figures on agriculture. Similar to the case of the semestrial reports, the percentage of members that presented their annual report has been very high, between 81% and 97%, since from 2006 to 2017. We should point out that the OIE codes do not require any requirements for the presentation of the annual reports. However, the average went down by 8 months, or rather from 8 months in 2006 to 3 months in 2007. I would like to recall that there is a great deal of compliance on the part of member states in terms of the average of the countries that provide information on 4 out of the 5 sections of the annual report. However, often the section regarding vaccination or vaccines is left blank. As far as the annual report on wildlife diseases that are not on the OIE list, the percentage of members that have voluntarily sent the information went up from 32% in 2008 to 56% in 2011, and then dropped until the year 2015. Only a fourth of the members contribute to this international effort to provide information on wildlife diseases in 2017. In regional terms, Europe is the region that submitted the greatest number of reports, 57% of all the reports, followed by the Americas, Asia, the Far East and Oceania, the Middle East and Africa, 22%. These results might suggest that some delegates find it difficult to compile and to share reliable information on wildlife diseases. Therefore, it's important to consider what it means for you as OIE member countries to contribute to this notification effort. I would like to close this first section by identifying the accomplishments and the gaps encountered. We could identify as main successes that there's been a significant increase in the number of early warning reports sent by the members over the period of study. This means greater transparency, and it makes it easier for them to comply with the requirements of the OIE. However, the annual reports and the semestral, the quality and the regularity of the semestral and annual reports also increased. This is a major accomplishment for the member countries. However, we still have some gaps which we need to deal with when it comes to reactivity for the confirmation of events and the submission of immediate notifications after event confirmation, as well as the regularity of the follow-up reports on exceptional disease events after the initial notification. Finally, there are certain topics that are not related to livestock production, in particular in aquatic animal diseases and wildlife diseases. And there's room for improvement in those fields. And now in my second section, I'm going to present the diseases that are vector-borne. In general, they are affected by climate change. That's to say, the temperature and climatological patterns have an effect on the distribution of the diseases. Therefore, we selected 3 diseases that are vector-borne: Rift Valley fever, West Nile virus, and Bluetooth. When it comes to Rift Valley fever, that's a viral disease that's important. It's transmitted by arthropods, and it causes a great deal of morbidity in ruminants and humans. It has a very characteristic epidemiological cycle of considered episodic, separated by interepisodic periods. It's transmitted by vectors, and it's very difficult to notify and to prevent this disease. In the map, we can see in 2018 and early 2019, at that date, 9% of the member countries and territories presented that disease, 17 out of 192. All of them are in Africa or the nearby islands. In 2018 and up till May of 2019, we received 7 immediate notifications from 7 countries. In March 2018, South Sudan reported the first appearance of the disease in that country, as well as the first appearance in a zone in Chad. Subsequently, we received 4 reports of the reappearance of this disease in 4 countries. For these notifications, the regional representation of Africa for Africa and sub-regional representation of Africa for East Africa and the Horn of Africa provided their support to the member countries in order for them to comply with their notification obligations and to send immediate notifications. Kenya reported the appearance of this disease And the same day, there was a human case notified. In coordination with the Ministry of Health, they applied prevention measures so that in that year the impact of the disease was much less than in the previous outbreak, 2006 to 2007. As I said, this is a disease for which we have a higher level of information from the member countries. An average of 5% of the countries and territories notified the presence every semester, varying from 2% in 2005 to 9% in 2018. The average 70% of the countries that provide information on the incidence of disease did not present quantitative information, despite the fact that they declared the presence of the disease. When it comes to the quality of information in the countries that reported the disease, only 70% present quantitative information, but in that percent, it varies depending on the period. For example, during the greatest epidemics that occurred in 2010 and 2018, the proportion of affected members that provided quantitative data and early warning reports was very high when compared with the other periods. The complexity of the epidemiological cycles of Rift Valley fever, because of its inter-episodic and episodic periods, as well as the different approaches that the member states have in sending their reports, are obstacles in the road of the harmonization and interpretation of the reports. In some cases, the increase of cases in human beings was present in reports on animals. In order to solve this problem and to clarify the notification requisites, Chapter 8.15 is going to be presented to you, so that the comments and the changes proposed, because for those changes to be adopted to that chapter, we should point out that the FVR is affected by climate change, global warming. The OIE, along with the FAO and the WHO, is attempting through the GLEWS to make an analysis of that disease and to prevent it as best as possible in terms of the man-animal interface. Now, this second disease that I'm going to address is West Nile fever. That is a zoonosis caused by determined strains of the West Nile virus, and it's broadly distributed in 4 continents with a complex epidemiological cycle. From 2018 to May 2019, it was notified as being present in 14% of the countries. That's 27 out of 192. If we observe the map of the distribution of the disease, we can see that half of the countries affected over last year were in Europe, 14 out of 27, whereas the disease was also notified from other continents, the Americas, Africa, and Asia, in the Middle East. 11 countries sent a total of 18 immediate notifications, of which 5 were for the first appearance of the disease. Germany and Slovenia presented the occurrence of the disease in 2 owls and wild birds and horses. In Slovenia, it was a crow and a horse. And the 3 countries that notified the disease in one zone were Brazil, because of equine mortality, Bulgaria in corvidae, and Romania in horses, September 2018. On the average, 10% of the countries and territories notified the presence of this disease on a semestral basis. Greece, in July 2018, notified a case in birds, in wild birds and horses. And France and Croatia in equids in August 2018. Portugal and Turkey in October 2018, and Tunisia in November 2018. Those 3 countries reported cases in horses. Tunisia and Turkey notified the reappearance of this disease after it had been notified as absent in 2015 and 2014, respectively. However, there's a certain seasonality in this disease, with an increase in the number of countries affected over the second semester of each year, which corresponds to the period of WNF transmission in the Mediterranean basin due to the greater mosquito activity between June and November. Moreover, the WNF transmission period in Europe in 2018 began before in previous years. The climate conditions observed in Europe in the summer of 2018 were favorable to mosquito propagation. It's quite probable that those factors favored an early increase in mosquito population in southeastern Europe, thus increasing the disease incidence. The increase in human infections was 7.2 times higher than in the 2017 period. In the United States, there was also an increase in the number of human cases of WNF, which represented an increase of 20% when compared with human cases the previous year. Finally, let's go on to the situation of blue tongue. As you can see, that disease is an international disease because the vectors are present in many parts of Africa, America, Asia, Europe, and Oceania. If we look at the map, we can see that the distribution of that disease in 2018 and early 2019 was notified in 24% of countries and territories. 9 countries notified the appearance of blue tongue in the second half of 2018 through sending immediate notifications. 2 declared the appearance of new strains, Italy and Turkey. 6 notified the reappearance of the disease. Kenya didn't confirm the serotype. The others reported serotype 8, 4, or 2. In the case of Belgium, the notification came from March this year. Moreover, it's important to point out that over the period 2018 and early 2019, there was a 15 to 20% increase in reporting the presence of the disease in member countries and territories. That's a significant amount. Moreover, the variability of the serotypes was observed. There were 15 different serotypes as opposed to other diseases. In this case, 35% of the countries and territories affected were able to provide information on the serotype in circulation. In order better to understand the dynamics of the disease in space and time, if we look at this map, which represents information on the appearance of the disease since 1996, you will see that from 1996 to 2004, 79 countries and territories had notified the disease's presence. 42 countries and territories had presented information from 1996 to 1997 before the propagation of disease in southern Europe and northern Africa. 71 countries and territories reported the disease between 1998 and 2004. From 2005 and 2019, 43 countries had notified the presence or suspected presence of blue tongue through 178 immediate notifications. In the period 2005 to 2019, the spread of the disease in northern Europe and eastern Europe is rather obvious. Over many years, it was considered that blue tongue was limited to a range of latitudes between 35 south and 40 north. However, since 1998, several strains have spread beyond that range, extending to almost 60 degrees north. Between 2005 and 2019, 43 countries notified the presence or suspected presence of blue tongue through 179 immediate notifications. The most recent change in the disease dynamic has been its reappearance in several European countries and Northern African countries, as well as the appearance of new strains in other countries. To conclude this section on vector-borne diseases, we can point out that for the 3 diseases presented, there was an increase in the incidence of outbreaks. So the question is, what do we need to do? Well, we need to enhance epidemic surveillance activities in areas of high risk and periods of high risk. We need to notify in due time any appearance of cases and integrate the data into the WAHIAD platform. And we need other sources of information, such as climatic series, environmental data, and vector distribution maps. That should help us to develop a better epidemiological analysis and to help countries to implement early detection and disease control. Now I will go on to diseases spread through movements of animals and animal products. The movement of animals and animal products through trade is one of the main factors of the spread of diseases if they are not subject to the proper controls. I'll look at avian influenza and two aquatic animal diseases, the koi herpes virus and Baticochytrium samandrivorans. When it comes to HPAI, it was notified in poultry in 23% of the member countries and territories, 43 out of 191. 10 countries and territories declared the presence of HPAI as well as low pathogenic avian influenza. 22 notified only HPAI and 11 only the low pathogenic avian influenza. The subtypes most frequently notified had been H5N1, followed by H5N8, H5N2, H5N6, and by 15 and 9 countries, respectively. Other subtypes were also notified. The diversity of subtypes notified in poultry for the period is quite considerable if we consider that when they circulate in the same geographical areas, co-infections by different viruses, influenza viruses, in the same animals create a risk of recombination, and that can generate new influenza viruses. When it comes to the distribution of HPAI in birds other than poultry, around 14% of the countries, 27 out of 191, notified the presence of that disease. The most frequently notified subtypes were similar to those of poultry, and the most frequent were H5N6, followed by H5N8, H5N1, and H5. The diversity of subtypes notified in birds other than poultry is much lower than in poultry, but that can be due to the fact that monitoring is much lower in that category of birds when compared with poultry. 38 member countries and territories notified the presence of avian influenza through 105 immediate notifications, of which 85 were for a reoccurrence of the disease. 11 notified the appearance of new strains, mainly in wild birds. 7 had declared the first appearance of subtype H5N6 in HPAI. Germany, Finland, Iran, Ireland, the United Kingdom, Sweden, and Cambodia. Pakistan had notified subtype H5N8 of HPAI. France, subtype H5N5 of low pathogenic avian influenza. Egypt, subtype H5N2 in China, subtype H7N9. Taipei, China, subtype H7N7 in Cambodia, subtype H7N5 of low pathogenic avian influenza. 5 countries also reported the first appearance of the disease: Afghanistan, Bulgaria, Sweden, China, and Indonesia in poultry. The percentage of countries that notified the presence of HPAI went up significantly between 2006 and 2017. Those were the maximum points. The disease in poultry, in which more than a fourth of countries and territories notified the presence of the disease in poultry. In terms of low pathogenic avian influenza, the percentage of countries notified it has been rather stable, with no significant decrease or increase. So I can say that the high percentage of countries and territories affected by HPAI in all sorts of birds, 27%, and the high number of circulating subtypes in this population, 15 different subtypes, as well as the fact that, as in previous periods, the presence of the disease in poultry affected the countries and territories of all the regions of the OIE, more than in wild birds. All this means that we need to maintain international coordination and cooperation. The data presented show a general improvement in the surveillance capacities of countries and territories, but we continue to need to improve surveillance in wild birds. because of their zoonotic potential, and the OIE standards and the transparency of information sent through WAHIS help to guarantee a framework for veterinary services to implement effective control, vigilance, and notification measures. The OIE will continue to follow the situation of avian influenza very closely and will continue to inform its members. The last section will present two aquatic animal diseases. Infection by the koi herpes virus and infection with B. salamandriovorans. Those two diseases exist in aquatic animals. When it comes to carpa koi, that's an infection with a herpes virus that's highly contagious. The carpa koi and the carpa koi, and that disease was added to the list of diseases of compulsory notification in 2007. It was added because that was the most frequently notified aquatic animal disease in 2018 and 2019. Moreover, it's considered to be of international interest because it's present in all the regions of the OIE. For its part, B. salamandrovirans had been identified for the first time in 2013 due to a drastic drop in salamander population, and in 2018 it was included on the list of compulsory notification. In the same year, a technical sheet was drafted for in order to inform the members. The geographical distribution of these diseases can be seen on this slide. The infection by the carpa koi herpavirus was in 17% of the countries and territories, and B. salamandrovirans in 2%. The percentage of countries and territories that notified the presence of the infection by the herpes virus, the carpa koi herpes virus, was rather stable, 12 to 13% in 2014, but went up to 18% in the second semester of 2018. However, its presence in the world over the period of analysis has been rather stable on the whole. In terms of immediate notifications over the year, only 4 countries have sent immediate notifications for carpa koi. There were 2 occurrences of the disease in Romania, and one in Romania, one in Italy, and an occurrence in Canada, as well as the first occurrence in Iraq. Only 30% of the countries that presented information said that there is active surveillance for carpa koi. To conclude this section, it's important to mention that the main transmission pathway has been related to human activities. Therefore, it's necessary to apply risk management techniques based on OIE standards, such as biosecurity at the farm level, and in order all of this is necessary, along with communication, cooperation, and rapid actions, which are key to control of the disease. Capacities in monitoring and surveillance need to be reinforced. I should also point out that the notification of these aquatic animal diseases is an obligation incumbent on all the members of the OIE, both animals, aquaculture animals, and animals that are captured live. Let me give you some information on OIE WAHIS projects to conclude my remarks. The progress in the OIE WAHIS, well, since what I presented today underscores the priority given for countries to strengthen their tools for disease notification. We hope that in 2020 I can present a user-friendly, intuitive, and more efficient platform that will make it possible for dynamic mapping and high resolution, as well as easy access to information and its analysis. We will also work on interoperability and integration with other information systems. I'd like to ask the members of the Assembly to take a close look at OIE WAHIS. When it comes to the transition, there are 3 steps that the members must consider. As of September 2019, the countries will be asked to send all the information they have up through the first semester 2019, because as of that date, all the information received will be treated in the new platform. In February 2020, there will be all the training courses for the focal points and the use of the new system, so that by the first semester 2020, we will have an internationally operational platform. Moreover, I ask for your support to send your reports out in due time, we will help you out with various communication activities so the transition to the new platform can be as smooth and efficient as possible for all members.